birthday?
You gotta start over.
All right, January 13th.
Oh, 2005.
2005, January 19th, 2005. Okay. So I've got chest fest every 4 hours, and as needed, I have a patient with cystic fibrosis and a CF exacerbation. All right, so chest fest. So I'm gonna look at, I'm either gonna decide the settings for the patient. First I'm gonna ask the patient what setting they use at home. Okay.
Because they're a CF patient.
Yeah,
And you
so
know
they
that
might
they've
have
done it.
already know what settings they like.
Okay.
And they're used to at home, and then we just kind of match with their, kind of like doing home O2. If they're on home oxygen, we don't ever take them off. If they're on 2 liters at home, we make sure they leave on 2 liters or whatever they need, right? So we don't want to lower them, take them below 2 liters per minute. So ask the patient. I always ask the patient what their home settings are, and if they're like, just fire it up, whatever you want to do, you know. So we're going to decide our own settings today. Then I'm going to keep sats greater than 92%. So something else that we're going to need to start looking at. Where's the plug for the thing? Why aren't you working? I tell you, am I missing something?
The bed?
I'm gonna start pulling this on you too. Thank you. Before I come into the room, I'm not in the room yet. Notice his eyes are closing. It's not even, it's getting towards breakfast time. Sleeping. All right. So I have Jason Voorhees again, 19-year-old male. We'll say April 19th, 2005. I need the year. Cystic fibrosis exacerbation. I'm going to do chest fast, get this set up every 4 hours and as needed. RT is going to decide settings, or we're going to use patient's home settings, and I'm going to keep the patient greater than 92%. Good morning.
Good morning.
Hey, how you doing?
Good.
Good. I'm Arnie. I'm with Respiratory. I'm here to do some chest physiotherapy, help you cough up some mucus. How's that sound?
Sounds good.
Before I get started, let me get your name and date of birth.
What?
April 19, 2005.
There you go.
And your name.
Jason Voorhees.
Okay, nice to meet you, Jason. So you got cystic fibrosis, I see.
Yes.
Yeah. Well, I'm gonna help you get rid of some of that mucus. How you feeling?
I feel like what does the cystic fibrosis patient feel like?
Congested.
Congested. Okay.
Sometimes
I feel like I have a
short
lot
breath.
of mucus.
Yeah. I'm gonna set you up. Is that okay?
Yes.
So what you're gonna see is we're gonna start laying patients flat. It's gonna do effective therapy when they're laying flat. Now, so this, you want them in a higher position. And if you could sit on the edge of the bed, I would do that. All right, I'm gonna put this behind me. Is that okay?
Yes.
Okay. How's that feel? Is that all right?
Yes.
Okay. So have you ever used a chest vest before?
Yes, at home.
Okay. What's your home setting?
10.
10. Okay. Well, we'll start with 10. I'm gonna do 3 levels of therapy on you, if that's all right, since you're in here. We'll start with 10. We'll move to 12, and then we'll go to 14. We'll see how you tolerate that. Does that sound good?
Sounds good.
We're gonna do this for about 30 minutes. You know, it's gonna shake you. Have you eaten recently?
No.
No. Okay, good. You don't want to eat before this, or else the risk of nausea and aspiration is elevated. So if it's okay with you, I'm gonna get some check some of your vital signs. Is that okay?
Yes.
All right. So I'm gonna put this on your finger. And what's my oxygen saturation?
98.
Okay. I'm gonna check your heart rate. What's my heart rate?
70.
Okay. I am gonna look at my patient's color. What's my color? Huh?
Pink.
Pink? Okay. I'm gonna listen to your lungs. Is that okay?
Yes.
Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Obviously, this is a male. Deep breath. Deep breath. And then I would listen to the back. What would you expect his lungs to sound like?
Diminished.
Okay, what else?
Crackles.
Crackles.
Or ronca.
Yeah,
Crackles?
bacon and crackles or ronca, yeah.
Okay.
So you could hear fluid in the larger airways, but a lot of times they're really diminished, especially in their bases, and then they'll have crackles. So what ends up happening to these guys is due to the chronic infection that they have, they end up with something called bronchiectasis. And basically, if you think about veins, veins are nice and tubular, they're round, so are our airways. And over time, the walls start to kind of develop pockets. And then you get like cylindrical bronchiectasis, and the saccular is the worst. You actually turn into sacs, and they fill with pus. So depending on the severity, you guys will see it in disease. So bronchiectasis is another obstructive disease that we deal with that produces a lot of mucus, and it's due to the chronic infection. So, and then colonization of bacteria as well. So crackles is not uncommon because they can also get scarring from all the damage, right? So there's a lot of mucus. They can have bronchiectasis and often do, and they can also have scarring. So hearing crackles is not going to be uncommon, okay? And it may be everywhere, okay? All right, so I've got my heart rate, I've got my sat, I've got my breath sounds, so I've finished with crackles. I'm gonna put my hand on your chest, is that okay?
Yes.
What's my respiratory rate? 12. Okay. So I got all my vitals. If that's all right with you, I leave this on. Time management. That way I don't take it off, clean it, and put it away. I just leave it on the patient. That way I can monitor their vitals during their therapy. All right. So we're gonna fit you for a size. Does that sound good? I think I'm gonna try this, but I don't think it's gonna be big enough. But we're gonna try, okay? So you're gonna put this in the front here. Lift you up. This across the chest wall here, and it's just a little too small. So we're gonna pitch this guy. Unfortunately, I don't have a small. We're gonna do this. I'm just gonna lift you up. And sometimes you need help with this to get this in place. Again, you want it on the chest wall. You wanna make sure that the patient is covered. I'll lift your arm up, is that okay?
Yes.
Good. Just lift your arm up here. And then we're gonna cross his chest. Lift your arms up there. And then I'm gonna make sure I can fit a hand in between there if I can. So you can see I have my ports here where I can connect my guy. All right, you can put your hands back down. All right, put this back on your finger. All right, just give me a second. I'm gonna plug my stuff in, okay? Plug this in the back. Right outlet.
For the competency, will it all be undone? So
Yes,
we can do
ma'am.
it? Okay.
You know it. I'm gonna give you this one for over there. Look at that. Plug this guy in. I'm gonna hand this to you, so if you feel like you need to stop the treatment for any reason, you just squish that guy, okay?
Okay.
Are those tubes the same on both sides?
Yes, they're the same on both sides. I'm gonna lift your arm up again, is that okay? Good question. So I would get it, you see how this is here? I would get, so that's not exposed anymore. Okay. And then, can I have that pillow from behind his head, please?
No.
The other thing I don't wanna do is have his arms, this rubbing under his underarm. I'm gonna put this, you can do anything under there just to protect from the, yeah.
You have a squeezy thing.
Give me a second, give me a second. All right, so here's your squisher. I'm gonna go ahead and put this on this hand. All right, so you got your squisher, you good?
Yes.
All right, so I'm gonna program it. We're gonna start at 10 on the hertz, and I'm gonna do 2 on the pressure for 30 minutes. All right, you ready?
Yeah.
All right. How's that feel? Feel good?
Yes.
Okay, we're gonna start it. you doing?
Good.
Good, all right. So it's been 10 minutes. I'm gonna stop it. Go ahead and take a deep breath in and cough for me. Ooh, ooh.
Yeah, I
A little
know.
bronchitis there.
I
Get
woke
anything
up-
up?
I woke up, yes, a little.
Yeah, what'd you get? Like what's the dime, nickel,
size.
quarter, dime size?
Size.
Is it thick or thin?
It's gonna be thick.
How would you describe it? Thick? Okay, what color is it?
White?
Green.
Green?
Green,
Okay.
yellow. They suit them. These are the guys that got the green stuff.
Oh, okay.
Okay. Does it taste bad?
Yes.
I would expect that with that infection. All right, we're gonna go up by 2 on this. And are you ready? Fire it up.
So we're not gonna increase the pressure at any point unless it's just to adjust for their comfort.
Correct. Yeah. Yeah. So that you kind of figure out what works from it. Like for me, that I was like, I'll start at this one. It was too tight, so I would think like, ooh, that's just too much. So I increased it. So just ask them if the pressure feels comfortable. All right. So it's been 10 minutes again. I'm gonna stop it. Take a deep breath in and cough for me again. Okay. Sounds a little drier. Did you cough anything up?
Yes.
Yeah. What'd you get this time? Dime, nickel, quarter, $50, shot glass. What'd you get?
Shot glass.
These guys will cough up a shot glass.
Shot
They will
glass.
fill an entire cup in no time.
Ooh.
Okay, taste bad still?
Yes.
Okay, still feel thick?
Yeah.
Okay. Color?
Green.
Still green? Okay. All right, we're gonna go up by 2 more and we're gonna do the last 10 minutes, so we're gonna go ahead and fire that out. You ready to sing a song with me?
The do you do the lollipop then?
I have literally put that on multiple times and sung that to them.
Nice.
If it's green in the beginning, it's gonna stay green, right?
I mean, it can get a little bit better, right? So if you think about when you have something that's really, really tenacious and it's blocking your tubes and you get like a little bit of a cast, how many of you guys, when you first get up in the morning and the first stuff that you cough out is really, really dark and it's almost like hard looking? Those are casts in your airways. So, well, we already know about that. You don't need to remind us. We already know about y'all in the morning. But it's hard looking and it's darker. It's always the darkest. You cough that out. And then you cough out some more and it kind of thins out a little bit more once you kind of break that out. And then it can actually get more like a deluge. They just cough a ton up and out.
And that's the goal with the CF patient is that they cough to the point where it's no longer thick. Okay.
We want to get those secretions out. We want to clear them out.
Not that it'll just be gone
Yeah.
completely.
It's never going to be gone,
Yeah.
unfortunately.
Okay.
They're going to have a chronic buildup of that. All right, so we're going to stop again, and we're all set. So now I'm going to take this from me. Take a deep breath in and cough for me again. Ooh, I heard a lot that time.
Yes.
Yeah. How much did we cough up this time?
Shot glass.
Got a shot glass out. Good. That's really good that we got that out. I'll take this off you, okay? I know that feels better too. Does this still look the same, taste the same, feel the same?
It tastes better.
If there's such a thing.
There is such a thing.
Still tastes gross.
And it's
Not
thinner.
as bad.
Not as bad and it's thinner.
Okay. So we're gonna do that.
Yeah, you question
All right.
everything you said.
I do.
Be confident.
All right, so if it's all right with you, I'm gonna go ahead and get another set of vitals on. Is that okay? So it's my oxygenation now.
94.
Okay, so that I'm not mad at that at all. Well, you could either see an improvement in saturation, or you might see a little drop in saturation from all the work that they do, right? You can, a little bit. The important thing is that they tolerate it and that we actually get productive work from that. And then my heart rate is
75.
my hand here again, my respiratory rate.
13?
Okay, I'm gonna put this on you again. Take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. I'm gonna have you sit up, I listen to your back. Okay, what do my lungs sound like now?
Less crackles.
Okay. Maybe the bronchi's gone. They probably still have crackles because it just doesn't ever go away. You might also hear a little bit more aeration in there, or they just might stay diminished. Okay. Color?
Pink.
Okay. If the patient had tube feeds, let's say they were on the ventilator and they had tube feeds, you can turn them back on now. So they can eat for at least 30 minutes. That includes with tube feeds. And when you come in the room and they are on tube feeds, you have to turn them off. Okay, otherwise, again, that increases the risk. And having them sitting up in a higher position also decreases risk of aspiration.
You wanna keep them sitting up for a while after the treatment?
You don't have to after, just for the treatment.
Okay.
Okay, so I'm all set. So he doesn't have any tube feeds, I don't have to worry about that. How you feel now?
Better.
Good. All right, well, I'm gonna be back in about 4 hours to give you another treatment. If you wanna use it in between, just give me a call. I can, if you feel like you need it. Okay, you have it as needed as well, just let us know, come back. Is there anything you need before I go?
No.
Okay, well, I'll see you later, it's nice meeting you this morning.
You too.
All right.
Hi.
Sweat? And then I'm gonna chart.
So if they are on a ventilator with the tube, you turn that off, but are there, like, I've only seen a ventilator that night at open house. Are there alarms that would go off because
Oh,
of
yeah.
that shake? Okay.
So the one, that reminds me, the other thing you might wanna do if they're on telemetry. So as soon as you fire this chest vest up, what's gonna happen to the heart rate on the telemetry monitor?
Oh, it's
They're gonna go
Oh,
into
weird.
extreme tachycardia.
And then
And
everyone
the nurse
will
is
come
gonna run in
running.
there and have a heart attack, and then she's gonna see that you had a chest vest on, and she's gonna be, I'm like, I'm so sorry, I didn't tell you, my bad. And then, or, you know, like, just wait till, if it's a nurse that you really like, you might just do it on purpose. Like John used to mess with me. I don't know if I ever told you about John at the hospital. He would call me.
Yeah.
Huh? Hot John? Yeah. Hot John, the nurse. Huh?
Shut up, Whitney.
He's in the now. He's working somewhere else. But.
If you come in and they just ate, you come back in 30 minutes,
Yeah.
could you keep?
You go do somebody else.
Is there like a time, it has to be 30 minutes?
I would.
So they just ate 20 minutes ago, would you do it?
Those would argue, yeah, 20 minutes is fine. I'm kind of big on the old swimmer. I want to know, it takes 30 to 45 minutes really for you to digest. And it takes me longer than that.
Well, plus I don't want them to vomit while I'm there.
But here's the thing too, like if you become nauseous,
Yeah.
just push, you got your little squeezer will stop, right? And you have them sitting up so they're in a position where they
If
could,
they-
if they needed to. And if they're already nauseous at baseline, I probably wouldn't even do the therapy.
Okay.
If someone's actively vomiting or, you know, has had active vomiting, I wouldn't even do the therapy. And they usually got something going on in their guts.
Yeah.
Right, so we would just let the doc know, hey, I can't really do therapy, they're actively vomiting or they're actively nauseous. So once the nausea is under control, you can do that. So other contraindications to doing this therapy is active hemoptysis, bleeding in the lung. So again, if I've got a clot, I want that clot to stay in place. If I have a lot of coughing, I could bust that clot and they could start actively bleeding again. So active hemoptysis is a contraindication to chest physiotherapy, period.
I guess you wouldn't do this with someone who had abdominal surgery either.
No,
No. Yeah.
no,
Which buttons do
You
you
can't
like?
slam that.
yeah, you don't wanna do, what was that?
Oh, okay. I just
So you've
didn't see
got,
which
if you
buttons.
hit the off again, and hit off and hit on, it'll go to normal. You can have program, and then you would hit program it. And then you could set your hertz, your pressure, and how long you wanna deliver the treatment. Okay, so it's always this program, and then once you're here, you can adjust up or down for each one. So you'd hit off, and it would take you back to the screen, so you wanna see that program. And this is one of the hardest things that students always have, is when they get up here and then they don't know how to set it. I'm like, you didn't practice.
Yeah.
Yeah.
So I will know. I will know.
Is there like an age limit on it?
Mm.
No.
I mean, they don't do it on infants, but
Yeah.
yeah, as long as they can, kids, yeah, all day long.
They love it.
Mhm.
They don't want to be shaped.
Shake me.
Yeah, we don't want shaking babies. So they have, you know, they should be, I would say probably 2 years and up, I would think, maybe 2 to 3 years and up. I honestly don't know, where they started with age. You have to look that up.
So with cystic fibrosis, what are they feeling? They just, what's going on?
Put it on, I want you guys to put it
No,
on.
no, no, I'm talking about like how did, like, what are they physical? What are they feeling? Like tight chest?
They'll feel
Can't
congested,
breathe, are they-
tight, short of breath. They'll look a lot like somebody with emphysema. They're also thin, frail, they have pale pallor typically. Their pallor's not good. Somebody pull up end-stage cystic fibrosis patient and hit images. They're on oxygen, so they're on a nasal cannula, at home even, in later stages, but they're always thin, frail, barrel-chested. They look a lot like an emphysema patient, except they're not pink, they're pale. They call them pink puffers for emphysema.
And the machine and everything stays in the room until the patient leaves. The machine is
Yep.
reusable, but the tubing.
Huh?
The tubing, is it, tossed after
No,
each patient?
it's single patient use, so it'll stay with that patient until
And
they
then
leave.
it's tossed.
And then it's pitched,
Okay.
and then we just wipe down the machine and the cords and everything, and then it's ready for use for the next patient. Bless you.
Oh, there's good videos about like a day in the life of a cystic fibrosis patient.